Well, it's been many years actually, and really excited about that. Leggett Personal Injury Lawyers, one of their key areas on the research side has been providing funding for the research of Dr. Doug Fraser, looking at rear occupancy or rear occupant injuries in motor vehicle collisions.
We've been inspired by the help that our clients have been given. We represent a lot of children, and the foundation, of course, supports the work of the hospital, the neonatal unit, all through the lifespan.
We're funding the resource center, the Family Resource Center at Children's Hospital. And it's something that we really value because it's a place where families and patients can go to get the resources very much needed on how to navigate through the legal system, navigate through the health system, and just understand a little bit better what they're going through.
So Doug Fraser's work, I heard about. I was invited to a talk that he gave, and Kevin McCafferty was there, and I believe someone from Transport Canada, and I was astonished to hear that we don't really know where's the best place to put a child in the back seat of a car.
Any research that had been done to that point had been done with dummies that were just sort of little versions of adult dummies, and they didn't properly represent how children are built, which is with big heads. And so this research was going to be able to study the impact of car crashes on children, the way they're made, and so we were pretty excited about that.
We focus on helping kids in any way that we can as a foundation, and I think that the research that Leggett is funding will certainly move that forward.
3M is a science company, and we're focused on improving every life in Canada with products such as Post-it notes, wound care products, and stethoscopes, enhancing every home with products like Scotch Tape and Scotch-Brite, and improving every company with industrial adhesives and personal safety products.
So 3M Canada has had a very deep and long-standing relationship with our work at St. Joseph's.
Since 1984, 3M Canada has supported Lawson Research Institute and St. Joseph's Healthcare Foundation in many ways through philanthropy and through volunteerism.
When you look at our work, we try to look at community partners that have had longevity with the organization, that have had a very deep commitment to our mission at St. Joseph's, and that have really directed philanthropic gifts to really innovative research projects. And 3M Canada has really done that across the board. At St. Joseph's Hospital, 3M has been responsible for funding surgical innovations in research in our Roth McFarlane Hand and Upper Limb Center. They have funded clinical innovations in osteoporosis. We have the 3M Osteoporosis Clinic at St. Joseph's Hospital. And most recently, they've made a very significant investment in the creation of a unique endowed scientific leadership role in diagnostic imaging that has enormous potential for the diagnosis and ongoing treatment of disease.
Science is just science until you apply it to life, and 3M Canada is proud to sponsor medical imaging and research in the London community.
I would say 3M Canada has done that in a way that should be modeled by other corporations. They've really set a pace. They have been real leaders, philanthropic leaders, in funding medical research. We really need that partnership now in Canada more than ever, and we're really grateful to our hometown, 3M Canada, for doing that for us at St. Joseph's.
The Breast Cancer Society of Canada was founded in 1991 by a family whose quest was to find somewhere to fund research that would cure breast cancer patients and find a cure for their daughter. It's fully funded by donors and donations. We have no government funding, and we count on the support of all of our donors to help us fund research for breast cancer.
Very fortunate to have the very generous support of the Breast Cancer Society of Canada for many years, dating back actually to 1998, when a partnership was created between the Breast Cancer Society of Canada and the London Regional Cancer Program, creating the Pamela Greenaway Colmeyer Translational Cancer Research Unit. And since that time, they've donated over $10 million in support of a great research enterprise that has made great strides, transformational in fact, in terms of breast cancer research.
The Breast Cancer Society of Canada shares this common vision that we have in the TBCRU of doing very impactful research that's going to rapidly translate from the research bench to the patients. And it's been amazing to work with them to help kind of bring that vision to life in Canada.
London actually offers a unique opportunity. They do a fantastic job of integrating all the multidisciplinary pieces that would be required for really top-notch research. So our researchers have the opportunity to actually meet with patients. They have the opportunity to work with colleagues and doctors at their bedsides. So not only is it a bench-to-bedside approach, but it's a bedside-to-bench approach. And London offered us that unique opportunity to provide that kind of funding, which is why it's been so important to maintain the relationship over so many years.
So we're truly grateful for their support, and we want to recognize them for having that vision so many years ago and seeing the impact and the transformations had today.